Are there any natural ways for me to get rid of my under eye bags? I've tried everything. Also, my eyes water a lot. What does this mean?
Thank you for your question. You've submitted a single photo, and with the eye looking down, you're asking, is there a natural way to get rid of under eye bags, as well as you mentioning in your question that your eyes are watery. So I'll explain to you how we approach patients with your concerns in our practice. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And this means that I first trained in eye surgery and then specialized as a super specialist in the areas of eyelid surgery. So under eye bags is something I deal with a lot every day. And when we listen to concerns like yours, it is a typical progression of how people approach their eyes after they first notice under eye bags. First step is very often trying to eliminate salt and deal with any issues related to allergies or sinus issues. Very often people also go to the local retailer and look for some kind of miracle under eye cream, which reality is under eye creams have a limited ability to do anything better than improve skin quality overall through hydration or moisturization. So when we look at under eye bags, we're dealing with most of the time the type of bags which never go away in spite of, I should say, not sleeping properly or getting enough rest and managing allergies. Typically what you are dealing with is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally under your eyes pushes forward and creates an undesirable bulge. That is something that you're trying to relieve naturally. With the advent of hyaluronic acid fillers, there is a subset of patients who can benefit from filling the tear trough area, the area that's like a groove right next to the under eye bag, to soften that transition. This is still a procedure. It may be less invasive from some perspective than surgery, but it's still a procedure. And what we're trying to do is create a contour, an evenness between those two areas. When the puffiness is more prominent, then we perform some type of lower eyelid blepharoplasty. This means that what we're doing is addressing the fat pockets, and in a case like yours, even though it's one position, I would probably anticipate that there's not a lot of extra skin. We would approach the eyelid bags from the inside of the eyelid, called a transconjunctival blepharoplasty. This means there's no external incisions, no scars on the outside, and it's usually a very good and definitive procedure, so it doesn't require the ongoing maintenance of a hyaluronic acid filler. The exception to this is if you also happen to have hollows under the eyes that are happening concurrently. It's kind of an unfair imbalance. There's puffiness in one level and maybe hollowness at another level. It requires very meticulous, proper diagnosis and specialized care. And so I think that it's important that you at least understand that anatomic issue first. As far as the wateriness of the eyes, the most common issues with watery eyes has to do with allergies or dryness. Paradoxically, dry eyes can be very wet from reflexive tearing. That is an attempt for your body to lubricate eyes that are dry. Unfortunately, a lot of times the tear film is ineffective and needs supplementation. So I think you should now meet with a cosmetic surgeon who understands eyes. Very often, someone like myself, a cosmetic oculofacial plastic surgeon who has knowledge of ophthalmology and cosmetic surgery of the eyes, is typically a good fit for someone who has eye-related issues. This is in contrast to somebody who doesn't have watery eyes and wants to deal with the puffiness, because then there are other doctors who also perform this type of procedure. So understanding the diagnosis and the best management from the medical perspective and the surgical or interventional perspective will help you get to where you want to be. So I hope that was helpful. I wish you the best of luck. Thank you for your question.